Hi, my name is Alicia Sainer and I'm an Australian Physiotherapy Association titled Women's and Men's Pelvic Health Physiotherapist. Many people don't realise that physiotherapists are highly involved in the care of men having treatment for their prostate cancer. We are specifically trained to help people with their bladder and bowel symptoms. Symptoms such as incontinence, rushing to the toilet, constipation, not emptying completely, or going too frequently. We also help you to return to meaningful activities such as returning to work, returning to sport, and participating in activities that are meaningful with your family and friends. We do this through close goal setting, and getting to know your physiotherapist closely and intimately prior to your treatment is of great importance for this purpose. As physiotherapists, some of the main treatments we prescribe are pelvic floor muscle training before and after your surgery, bladder and bowel advice, which can include strategies to stop you from rushing to the toilet, to help you emptying and to avoid constipation, basic dietary advice for bowel management, fluid intake modification, and also some lifestyle advice regarding general exercise, returning to work, and negotiating sport and return to meaningful activities. This video will show you what to expect when you first visit with your physiotherapist before you have your treatment for prostate cancer. For the purpose of this video, we will be introducing you to a patient who will be undergoing surgery for their prostate cancer in the form of a radical prostatectomy. Coming into the centre today is Bob. Bob is 65 years old and was recently diagnosed with prostate cancer. In the next 4 weeks, Bob is going to have surgery to manage his prostate cancer in the form of a radical prostatectomy. Today, he is attending for his first physiotherapy session to learn about pelvic floor muscle exercises, and so we can start pelvic floor muscle training before his operation. Hi Bob. My name's Alicia and I'm a physiotherapist who works with people who have issues with their bladder and bowel. The reason you've come to see me today is because in 4 weeks' time you're having your operation to remove your prostate for prostate cancer. One of the most common side effects after this operation is loss of bladder control, and this typically happens with activities of exertion or ones that create extra pressure in your tummy. So for example, this might happen when you stand up from a chair, when you cough, or when you sneeze. This is a very common side effect after the operation, and we will be seeing you today as well as every 4 weeks after your operation to help manage this. Were you aware that urinary incontinence may be a side effect after the operation?
Yes, my GP and specialist did tell me that would be the case.
So one of the roles that physiotherapists play is to teach you some exercises to use the muscles around your bladder and bowel that will help to support that bladder control after the operation.
No problem at all, but why is it important to start early? Can't I just leave it till after the operation?
There's some very good research that tells us that doing the exercises before your operation can actually help to reduce the amount of time that you have incontinence, and it may also help to reduce the severity or how much incontinence you have. The reason we like to do this before the operation is so we're doing it while you're pain-free, and that it's a really good opportunity to learn this new skill while you're not trying to negotiate pads as well.
Great, it sounds like a great idea to get started as soon as possible.
Thanks Bob, but firstly I'd like to get to know you a bit better and ask you a few questions about your history and general health before we get started on the exercises. The reason we are interested in Bob's medical history is because there are certain medical conditions that can actually impact the way the bladder and the bowel behave. For example, if somebody has unstable diabetes, we would communicate with their GP to see if there are other forms of management that are required. If somebody is experiencing high levels of distress or has a history of anxiety or depression, we certainly want to make sure that those symptoms are well managed going into their treatment plan. Okay, Bob, so from what you told me, you are a type 2 diabetic, but that seems to be quite well controlled with the support of your GP and diabetes educator. We've also noted your history of anxiety and depression, again, which is really quite well controlled with medication. We'd like to be mindful of this as you go through your treatment journey, because symptoms of distress and anxiety can be quite common as you do go through your treatment journey.
Yeah.
Other symptoms that we would be interested in from Bob is whether he had any thyroid or hormonal conditions, as well as any heart, lung or respiratory conditions such as asthma, COPD. We are also interested whether there is anything that would affect Bob's function. For example, if he had previous joint replacements or any other musculoskeletal related conditions. Bob, I'd now like you to tell me a little bit about how your bladder and bowel are behaving. Some of the things that I'm interested in are how often you go, whether you need to rush, whether you feel you empty completely, or whether there's any involuntary or accidental loss from either of those two things. Bob appears to not have any issues with his bladder or bowel, so we don't need to put any immediate management into place. However, if Bob did report symptoms, seeing him before his operation is a fantastic opportunity to be able to give him some management to work on. In the event that someone did require some basic advice around good bladder behaviours, some of the information we would give them is to aim to consume 1.5 to 2 litres of total fluid daily, aiming for the majority of that to be water. We would ideally like them to limit caffeine, soft drink and alcohol. Avoiding constipation is also a very important factor when managing the bladder. We don't encourage people to go to the toilet just in case. So by this, what we mean is not going to the toilet just in case before you leave for the shops, and also trying to avoid rushing. So not letting the bladder be the boss of you. When providing support to people regarding appropriate bowel habits, a lot of people don't actually know what normal frequency is. It's quite acceptable to go to the toilet to empty your bowels anywhere from 3 times a day to 3 times a week. The key message with your bowel is that you don't strain and avoid constipation. And how you can ensure this is to make sure that you eat 5 serves of vegetables and 2 serves of fruit a day, and drink plenty of water, aiming for approximately 1.5 to 2 litres of fluid a day. Another thing that can help with your bowels is to establish a routine, and the most useful way to do this is to try and have a bowel motion at approximately the same time each morning after you eat breakfast. So Bob, I know a bit about how your bladder and bowel are working, and I know a bit about your general health as well, but I'd like to know a little bit more about you and what's meaningful to you. So for example, I'd like to know whether you're still working. I'd like to know who you live with and what activities are important to you and that you would really like to get back to after your treatment. Bob currently works full-time as a storeman for a transport company. He is currently engaging in duties that require repetitive lifting of greater than 20 kilos. He has already had a discussion with his workplace to notify them that he will be requiring time off work, and he will have lifting restrictions and restrictions with time on his feet when he returns to work. It's very important to have this discussion with your employer well in advance so they can liaise with your GP, your physiotherapist and any other health professionals to be able to negotiate what is appropriate when getting back to work-related activities. So Bob, it's fantastic that you've taken the time and had the opportunity to speak with your employer about your upcoming surgery. Certainly, within the first 6 weeks, we want to avoid any lifting that would be around over the 5 kilo mark. Within the first 12 weeks, we want to avoid heavy lifting, so anything that is more than 10 to 15 kilos would certainly be off during that period of time. Other things to watch out for with your role at work are being on your feet for too long a period of time, and also symptoms of fatigue that can be quite common after the operation. If you like, I would be happy to communicate with your workplace to talk about a plan for when you do return to work after your operation. Now that we have taken some time to get to know Bob, we can now talk to him about the pelvic floor muscles and why pelvic floor muscle exercises are important for before his operation. Okay, Bob, now that we know about your bladder and bowel health, we can start to talk about the pelvic floor muscles. Do you know what they are and what they do?
Not really. I do know my wife did some exercises after the kids were born.
The pelvic floor muscles are responsible for controlling the bladder and bowel to stop us from having involuntary leakage. They also provide support for the organs that sit in your pelvis and can play a role in the quality of erectile function. They are a dome-shaped group of muscles that attach to your tailbone, your pubic bone, and various points in your pelvis. When they are working well, they help to close off the urethra and anus to keep the bladder and bowel controlled. Let's familiarise ourselves with this diagram. The yellow circle is the bladder. This is the place where urine is stored before it leaves the body. Sitting immediately below the bladder is a smaller pink circle. This is the prostate. What you can also see in the picture is a tube running from the bladder through the middle of the prostate and out of the end of the penis. This is the urethra, and it carries the urine from the bladder and out of the body. Sitting at the top of the urethra, right near where the bladder and prostate meet, is a very important structure called the internal sphincter. The job of this structure is to keep the opening between the bladder and the urethra closed until it is time to empty the bladder. Therefore, it is of great importance in maintaining bladder control. During your surgery, the internal sphincter will most likely be removed or highly damaged. This means that there is no barrier to stop the urine coming out during activities that require moderate exertion, such as standing from a chair, coughing, sneezing, bending, and lifting. To compensate for the missing internal sphincter, we then need to focus on the voluntary muscles, such as the pelvic floor muscles. As mentioned earlier, the pelvic floor muscles run from the tailbone at the back to the pubic bone at the front. When we squeeze them, they pull forwards on the rectum and backwards on the urethra to compress or flatten the urethra. This means that you can use the muscles to help your bladder control during certain activities. It is very important that you are taught properly so you can learn this new skill, and also so you can improve the muscle bulk in the area for optimal bladder and bowel support. The way in which a man can activate these muscles is to imagine that they are stopping their flow partway through urination. Some men also respond well to imagining that they are shortening their penis. When using your pelvic floor muscles, make sure that you maintain your normal breathing and do not overuse the muscles in your tummy, legs or shoulders. When fully dressed, it shouldn't be obvious that you are doing them. Now that we know where the pelvic floor muscles are situated, it's very important to learn how to use them and start doing some exercises before the operation. The reason we do this is so the pelvic floor muscles are appropriately closing off the urethra, and so we can improve some of the bulk in the area to better support the bladder and the urethra together. One way that you can check whether you are doing the muscles correctly is to stand with your pants down in front of a full-length mirror. That way you can visualise whether your penis is shortening and your testicles are lifting. It's also a good way to make sure that you are breathing properly and that you aren't contracting your tummy or shoulders. So Bob, now that you know a bit about how the pelvic floor muscles work, it would be really great for us to get an idea of whether you can actually contract them properly. One of the best ways we can do this is to use an ultrasound machine, so it gives us a picture of whether you're actually closing off that urethra or the tube using your pelvic floor muscles. Where we put the head of the ultrasound is on the bit between your testicles and your anus. This bit is called the perineum. Once we put the ultrasound head on there, we will ask you to do a few pelvic floor muscle squeezes, so remembering that you're going to imagine you're stopping the flow of urine. And we will be able to design an individualised training program for you based on that information. Are you comfortable if we go ahead with that examination today?
Yeah, sure.
In a moment, I'll ask you to go behind the curtain, which I'll pull across for privacy. I'll then ask you to remove your pants, including your underwear, and lay face up on the bed. There's a towel on the bed for you to put over the top of you. At any time you can ask me to stop the assessment, or you can let me know if you have any questions or concerns during. Many physiotherapists will use an ultrasound machine to determine whether a patient is contracting their pelvic floor muscles appropriately. On a male, where we place the ultrasound machine is on the bit between the testicles and the anus. We cover it in a cold gel and a condom and another layer of cold gel to be able to give us an appropriate picture. We can then look at this screen to show us whether the muscles are appropriately closing off the urethra. Not all physiotherapists will use an ultrasound machine. Some may wish to observe the genital area. Some may wish to perform a rectal examination. So now that we have the ultrasound on Bob, we are now going to ask him to do a pelvic floor muscle squeeze. Bob, do you remember the instructions that I gave you before about imagining you're stopping the flow of urine?
Yes.
What I'd like you to do now is, while you keep breathing normally and keep your tummy and shoulders relaxed, imagine you're stopping the flow.
Yeah.
Good. Good. Keep those muscles on and relax. Wonderful. So that's exactly what we're after, Bob. What we're going to do now is we're going to do a few repetitions of that, holding for 5 to 6 seconds to see how many you can do. Based on the number of repetitions that Bob can do and how long he can hold his maximal squeeze for, that will determine exactly the type of program that we do right for him to do before his operation. So Bob, now that you've had the assessment, was it what you were expecting?
No, it wasn't. I've been trying to do some exercises at home, but I'm not sure that I'm doing it the right way. It actually takes quite a lot of concentration.
Yes, you will find that the exercises will take a bit of concentration, and that's because today you've learnt a new skill. That's why it's very important that you do your program several times a day leading into the operation, because the skill takes practice. What will happen after the operation is you will visit with us every 2 to 4 weeks until we appropriately support you with your bladder control. During that time, we'll continue to progress these exercises to include activities such as lifting to help you to return to work, and we will also help you with any other goals you may have. So Bob, what I'd like to run through now is what I would like you to do between now and your operation. Bob will now do his exercises every day until the operation. The pre-operative physiotherapy appointment is of great importance, as we can provide Bob with some guidelines on activities that he can and can't do leading into the operation, as well as within the first weeks afterwards. Post-operatively, while the catheter is in, Bob will not do any pelvic floor muscle exercises. This is because we like to allow enough time for the join between the bladder and the urethra to heal appropriately. We will continue to support Bob post-operatively until all of his goals are reached and his bladder and bowel are well supported. Men who are undergoing radiotherapy treatment for prostate cancer may also benefit from seeing a pelvic health physiotherapist for the management of bladder and bowel symptoms.